to us Dr. Leah Mak, who's going to speak about scar prevention. Dr. Leah Mak is a practitioner in Hong Kong with a special interest in aesthetic medicine, graduated from the Faculty of Medicine at the Chinese University of Hong Kong, and holds a Master of Public Health degree. She also earned postgraduate diplomas in clinical dermatology from Queen Mary University of London and practical dermatology from Cardiff University, with a particular focus on combination therapy of rosacea. Dr. Mak is also a passionate health educator and a column writer, sharing valuable insights on various women's health topics. Please join me in welcoming Dr. Leah Mak. The time is yours.
Thank you, Dr. Jane, for your kind introduction. It's my pleasure to share in AMSC, and I'm sure all of you enjoyed the previous 3 speakers sharing about the management of acne scars. In the coming 15 minutes, I would like to share with you a new generation of scar gel management, which can effectively improve wound healing and reduce scar formation. Poor wound healing and scarring could be a nightmare to both patients and doctors. A scar could be itchy, unsightly, or painful. In some areas, it also restricts the range of movements, especially around the joint areas. As aesthetic physicians, we commonly prescribe topical antibiotic or topical corticosteroids to reduce the infection, inflammation, PIH, or scarring. I recently incorporated a new generation scar gel, which can effectively improve the patient's treatment outcome. Before introducing the product, let's see what are available in the market. They come in 2 forms, either a silicone gel or silicone patch. Both of them provide a sealed and moisturizing environment to enhance wound healing. However, the compliance is usually poor, and the gel is sticky and hard to dry. The patch is usually irritating. The new generation scar gel is a non-silicone-based herbal formula, Herbap Matrix. It prevents scar formation through cell-mediated intervention. The product received Geneva Invention Award in 2022 and got 2 patent technologies. So you may wonder, what actually is cell-mediated intervention? Let's have a revision about wound healing. The stellate cells, also known as myofibroblasts, are normally dormant. Upon injury, they are activated to help with wound healing by excreting extracellular matrix to seal the wound. Under normal circumstances, after the wound is healed, they become dormant again. But in many cases, they remain quite active. A simple scratch or rubbing from cloves can stimulate deposition of ECM, result in red, itchy, hypertrophic scar, even years after surgeries. The active ingredient of the gel is called flavanoglycoside, which can suppress myofibroblast activity. It is also antimicrobial. And this gel is invented and manufactured in Hong Kong. Please play the video now, okay? Now, let's have the inventor, Professor Zhang, explain to us the mechanism of this new generation scar gel.
Hypertrophic scars and keloidal scars are elevated scars that may leave lifelong cellular marks. According to the Grandview Research Incorporation, the global hypertrophic and keloidal scar treatment market size was valued at $4.8 billion in 2017 and is expected to reach $10.2 billion by 2025. Although hypertrophic scars and keloidal scars are not technically a health hazard, they create aesthetic concern, restrict physical movement, and may also lead to itching, tenderness, pain, or even depression and anxiety. The currently available scar removal products such as silicone patches and topical products may cause skin irritation, which has led researchers to look for safer and more effective solutions. Dr. Phyllis Zhang and Dr. Afra Zhang from the School of Chinese Medicine, HKBU, has developed a series of phytonutrient-based remedial fluids, which can be used as a general topical agent or complemented with a nano sprayer for the management of elevated scars. This invention is a safe, non-invasive, and convenient approach to suppress hypertrophic and keloidal scars in the comfort of sufferer's own home. This invention has been granted patents in the US, China, and Hong Kong.
Hypertrophic and keloidal scars are two different fibroproliferative disorders of the dermal tissue upon skin injury. In general, these scars are mainly characterized by the excessive formation of extracellular matrices, the ECMs, accumulated in the skin. When we study the development of these elevated scars, at the molecular level, we found that the activation and local proliferation of stellate cells, which are also called the myofibroblasts, in the dermal layer is considered prerequisite for the overproduction of ECMs, including the intensive formation of different subtypes of collagen bundles for filling up the wounds. And also in our previous studies, we observed that a cluster of small molecule flavonoid glycosides extracted from ferns could significantly suppress the activation and proliferation of skin myofibroblasts that we collected from patients' hypertrophic scars and keloids. And our small molecules also could greatly reduce the deposition of ECMs from these skin myofibroblasts. As a result, the formation of elevated scars can be prevented.
This invention has been successfully licensed to a company, and prototypes of the phytonutrient-based remedial fluids have been developed and undergoing product testing. The prototypes are designed to reduce raised scars and improve skin condition. So far, the prototypes have been distributed to over 50 volunteers with various types of scars and different skin conditions in the initial trial. Overall, positive feedbacks were received, including notable improvement of scar appearance, alleviation of itchy feeling, and prevention of excessive scar tissues. In 2019, the spin-off company was awarded the second prize of entrepreneurship proposal from the Challenge Cup China National Competition, as well as the second prize in the Innovation Nanshan Entrepreneur Star Contest 2019.
Thank you. Now let's see the before and after clinical photos. These are the scars from thyroid surgeries without scar management. The scars are red, swollen, and distorted. This 30-year-old lady used a gel soon after removal of sutures. After only 4 months, there was no granulation tissue formation. The second case is a 50-year-old gentleman with cat scratches on the forearm. After using the gel for 8 weeks, the scars could be barely seen. Another young man who had 2 big wounds on the periorbital area, he used the gel for 45 days with good recovery. This poor little girl had a bad fall on a rough surface, leaving a huge lesion on the cheek, requiring stitches. After 3 weeks, it was well healed. A 50-year-old lady with fractured humerus. She had multiple metal plates and nails inserted, leaving her scars on rotator cuff and arms. She consistently used it for 1 year with good outcome. This old lady with a burn injury, she initially had huge blister, and unfortunately, the scar was minimal after 2 weeks. A gentleman with knee injury, due to repeated joint movement, knee surgeries usually leave a hypertrophic scar, but it was prevented after 8 weeks use of the gel. Last but not the least, cesarean section scars from 3 years ago could also benefit from the gel. She used for 2 months with shorter and flatter scar. Newer cesarean section scars have even better result. This case also used for 2 months. So when shall we use this gel? As soon as the sutures are removed or the wound is dry. The golden period for wound repair is within 3 months. So, take-home message, early prevention of scar is important. It not only improves the satisfaction of the surgery, but also improves the patient's quality of life, especially after orthopedic surgeries involving the joints. That's the end of my presentation. Thank you very much.
Thank you very much. In the interest of time, we won't have time for the Q&A. Kindly, for those who have questions, you may approach the speakers personally. May we call on the speakers on the stage for a photo op so we can proceed with the next session. Thank you. Thank you very much for joining the SCAR sessions. Please stay on for the last session.